All right, part 3 is uncovering and impressing the implant and seating the final restoration. If you want the really good stuff, click on the blue link in the description below and subscribe to dentistrymasterclasses.com. That's where all my really good stuff is. An organized library of all the Dental Minute videos plus many comprehensive complete cases not seen in Dental Minute videos. Now you remember this was a bicuspid implant, a bicuspid tooth that had fractured. So we extracted the tooth, then placed the implant, abutment, and crown. Grafted the socket. That's the before and after. So this is a core, kind of like you take a core out of a watermelon. When you want these little tubes of watermelon, you just take a core in the tissue, this local anesthesia is fine, and remove that tissue and uncover the implant, remove the healing cap, and then this is the dentist open tray impression. This is not a problem because this was a man and he can open his mouth wide, but you can see to put this open tray impression coping into that implant, you've got a longer impression coping because it's got to stick through the impression tray, and you've also got to have enough room for the screwdriver to screw it in tight. So, you know, a small woman in the back of the mouth or probably in the bicuspid, you couldn't use this. You've got to use a closed tray impression. So this is the only one the dentist system has, and this is a little bit of an angulation issue. Really, that was right up and down the center of the socket. Now here's the open tray. We've cut out that part in the impression tray. Try it in. Be sure the impression coping sticking through the tray so we can get through it. So picture the space you've got to have here. You've got to have vertical space for an impression tray, vertical space for this impression coping, and then the screwdriver's about that long. You've got to have more vertical space to get the screwdriver in this hole and unscrew it. It's insane. Why would an implant company be an implant company without a closed tray impression coping? I don't get it. It's the same question. Why would an implant company be an implant company without shoulders on their drills and eliminate the issues that dentists have with implants? Okay, so anyway, we're going to use an open tray because we're using the dentist system. So what I'm doing now, and I'll show you with other implant cases I'm using the dentist drill system and a BioHorizon or one of the other implant systems that have closed tray impressions, implants, but with the BioHorizon drill. I mean, with the dentist drills that have the shoulders. Mm-hmm. So we place the impression coping, blow off any blood around the implant, squirt the polyether wash around the implant impression coping, and then push the tray to place. This is going to squirt out. Now, while I'm squirting or flowing the body polyether into that tray, I put a 2x2 over this hole to keep all the impression material from coming out through that hole. Then just before I put the tray in the mouth, I remove that 2x2, push it to place, and I put my finger over the orifice of the impression coping so it remains clear. Otherwise, that impression material will go over the top of it, and you'll have to cut it away or pinch it away with rongeers. This way, my finger is touching the tip of that impression coping, so it's, see, my finger's touching the tip of it. There it is. So I may have to just peel some of this away, but I've got access to the tip of the impression coping to put my screwdriver in there and unscrew it once the impression material sets. So see, I'm putting that in that hole and unscrewing the impression coping, and you can hear it unscrew because it goes click, 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 and I'll click it about 3 or 4 times to be sure it's unscrewed. Then once it's unscrewed, you can remove the impression from the mouth. See, that's just perfect. Now, if this was in the aesthetic area, You would let it heal for 3 months. You would uncover it, and you would probably put a provisional crown on a provisional abutment in the implant and let the tissue grow around that provisional crown, so it was ideal. If it's posterior, you really don't have to do that. Just go ahead and take your impression at the time you uncover the implant, because the tissue will be fine, the aesthetics will be fine. Then we're putting in the largest healing abutment that we can. Fit that to the place, to the spot. Be sure it doesn't touch the adjacent teeth. And this last section is seating the final restoration. And I've gone more and more to screw retained abutments and crowns, just because you don't have the cement layer around the crown. So that comes back from the lab. Unscrew the healing cap. Pinching the tissue at our center. And he said, now what I'm doing is replacing the screw that came back with the crown and abutment from the lab with a brand new screw. Why do you do that? Well, the lab has had to screw that screw in and out, in and out, in and out to adjust the interproximal contacts. They can't really tell how it's fitting unless they screw it in to near 35 Newton centimeters. So there's a good chance either the threads will be a little stripped, or upper part right in here where the screwdriver fits in will be stripped, and you won't be able to get it to 35 Newton centimeters. So I always place a new screw on any implant abutment and crown I'm seating, and I've eliminated the issue of possibly not getting 35 Newton centimeters. So that's a brand new screw. And then we place seca bond on the threads sticking out of the abutment, and this just locks them in. So I'm torquing it to 35 Newton centimeters, no problem at all. And then I'm coming back 10 minutes later, letting it sit, go check a hygiene patient, work on a consult, whatever you want to do, and come back and torque it again to 35 Newton centimeters after 10 to 15 minutes. Read the article in dentistrymasterclasses.com on how to eliminate screws in implants becoming loose. So do that every time. Don't just torque it once, but torque it, let it settle, and come back after 10 or 15 minutes and torque it again, and use the seca bond and change the screw every time. What's that? An ounce of prevention is worth a pound of cure. You don't want to have to be drilling back into that crown and replacing that screw later. So I'm torquing again to 35 Newton centimeters. This is plumber's tape. We used to use cotton balls, and that's okay. You can use cotton balls in the orifice, but now we use plumber's tape because it packs well. You don't have to pack it hard, just pack it in there, leaving about 1.5 millimeters or 2 of space coronal to the plumber's tape for the bonded composite. Then I'm going to place primer adhesive, blow that off, cure it for about 5 seconds, and then place a highly filled resin in the orifice. Check the contacts. Cure. Check the occlusion. You don't want any eccentric contacts on this implant, because that implant crown, because that can also lead to screw loosening if the patient clenches on it. So no eccentric contacts. And I'd like this crown to be about 1/2 of 1/1000th of an inch, a shim stock thickness out of occlusion at the time of seating. That's when the patient clenches their teeth real hard. I would like to be able to pull shim stock between this crown and the opposing tooth. And you certainly don't want any eccentric contacts, because if they are a clincher, they could loosen the screw. Now, I tell all these patients they should have a night guard or a dental snoring appliance, a sleep apnea device, just to keep them from bruxing at night. Then come back with a Shofu rubber wheel and polish that. There we have it. That's the dental minute. These techniques work, and they work every time.